Coming up, we'll be on location at Family Hearing Services in Chantilly, Virginia, discussing advances in hearing care and how they can help improve your hearing and improve the quality of your life with one of this region's top audiologists, Dr. Pinky Khatri. Dr. Khatri received her clinical doctorate in audiology from the prestigious Texas Tech University in Lubbock, Texas, and is widely recognized as one of this region's leading audiologists. Welcome, Dr. Khatri. It's a pleasure having you on our program.
Thank you so much. It's good to be here.
We have a lot to discuss. We've got a couple of patients joining us a bit later. But I wanted to begin, if I may, Doctor, by having you tell us how one determines if we are suffering from hearing loss. Because a lot of folks don't realize it, but they have a hearing problem.
Sure, yeah. It takes time. Since hearing loss develops over time with age, you see some subtle signs over time. Some of the common signs that you would see is having difficulty hear a conversation, especially when there's noise in the background. Say the television is on, you're trying to have a conversation, or the wife is doing dishes and you're trying to be there, trying to have conversation while there's little things in the background. Or even at a restaurant or conference meetings like this where there's a lot of people, you may say, are they mumbling or can you talk a little bit louder? What did you say again? Those are the common things you start saying. Yes. Also things like having difficulty talking over the phone or understanding conversation over the phone, or the most common one is the wife comes in and says, he's starting to have the TV volume too high these days. I think he has a hearing loss and he needs to be checked out. So those are some of the common signs that you would see. Of course, if somebody develops a sudden hearing loss due to some infection or something like that, then the signs are more drastic. You wake up one day and your hearing is gone, or you have a loud ringing in the ear and you notice that something has changed.
Very interesting. In fact, some of the examples that you just gave a few moments ago, I think literally all of us have someone in our family or know of someone that falls into one or more of those examples.
Oh, absolutely. Hearing loss is the third most chronic condition following arthritis and high blood pressure. So it's up there. There's more and more people with hearing loss, and these days I see even younger generation with all the loud music and everything coming in to have a hearing test, and I do see some hearing loss because of all the loud noise exposure.
Yes, and you know, the difference that stands out to me from what you just said a moment ago is that the other two examples that are the most prevalent issues that people deal with, and hearing loss as being the third, is the other two are generally diagnosed during our annual physicals. Whereas with hearing loss, we don't have that checked out by the internist or our primary care doctor.
Right.
So this is something that a lot of times goes undetected and therefore gets worse over a period of time.
You're absolutely right. And there's more and more research on how hearing loss is connected with diabetes, heart conditions, smoking, obesity, and especially the American Diabetes Association. They're working on getting having people with diabetes have a hearing test once a year, like they have all the other tests that's required as part of their diabetic management team.
Yes, and what would you say, Dr. Khatri, are some of the most common causes of hearing loss?
Hearing loss can be conductive in nature, and that's usually caused by problems in the outer or the middle ear. For example, there's excessive wax in the ear, they have fluid in the ear, or the bones in the middle ear, they're not functioning like the way it should, then that would cause a conductive type of hearing loss. Versus the more common one is a sensory neural hearing loss, and that's caused because of aging, reaction with certain drugs, or loud noise exposure and things like that.
And that's obviously the more common one, as you just said.
Absolutely.
Because we can all relate to that in some shape or form or the other, right?
Right.
Over life. I wanted to ask you, Dr. Khatri, if you could please tell us what's involved in the testing process for all of us out here wondering about what we have to go through to find out, to determine if we are suffering from any hearing loss.
Absolutely. So we start with sitting down, getting more information on where you're hearing, where you're having the most difficulty with your hearing, and we want to look into the kinds of medications that you take that may have a reaction and cause a hearing loss, or in general what other medical conditions you have that might correlate with hearing loss as well. Then we move on to looking in your ears, making sure there's no wax or foreign object in there, also to make sure there's no active drainage and no deformity before we get started with the actual hearing test. So the hearing part of the test, there's a few different things that are involved in that. We start with looking at the eardrum to make sure that the eardrum is functioning okay, there's no fluid or infection behind the eardrum, and also then we move on to the actual hearing part of the test where we test with beeps, and the patient just has to push a button every time they hear a beep. And we also do some speech testing, because when you think about it, hearing has two parts to it. One is recognizing sound present or absent, and the other is actually making sense of what is being said. So we go a little bit more further to see how their speech understanding is, and we also do speech and noise testing that gives us more realistic information as to how you're doing in your everyday listening situations with different levels of noises in the background. And we'll sit down, go over and discuss all the results with you. If we find that there's something medically related with the hearing loss, we refer you to a physician to rule out anything else that's going on and to treat it medically if that's possible. Or if you're a candidate for hearing aids, then we sit down, talk to you a little bit more about what are the different options, what's out there, what's available, and move on in that direction.
Oh, and obviously you have the latest technology here at your practice to go through that testing process.
Absolutely. So all of the equipment that we use is computerized and state-of-the-art, so we know that our results are accurate.
That's certainly good to have and to offer to the many folks that come to you.
Oh yes, definitely.
And not to mention you have a wide number of hearing aids for all types of folks, for all types of lifestyles, that are really not what one would think a hearing aid looks like or feels like anymore, compared to the options that we had available many years ago to us.
Oh yes, definitely. Hearing aids have, we deal with a lot of different manufacturers. We're not one manufacturer office where you come in and that's all the option that you have. We go through different options, and I usually demonstrate. We get one set up customized to the patient's hearing loss, so in that way, while we're discussing the test results, they're actually able to hear me better. They're not straining, they're actually sitting back, relaxed. Yeah. They're enjoying the hearing as we go through the process itself. And we narrow down the different technologies and say, this is what you came in with, these are the situations you had trouble in, and based on this, these are the different technologies that would suit the best for you.
So it's a customized hearing solution.
Oh yes, definitely, because even with two people with same hearing loss may have different hearing needs. So we sit down and customize it specifically for their hearing needs and also for their listening situations itself.
And I wanted to ask you, Dr. Khatri, what are some of the effects on us as folks suffering from hearing loss if it goes undetected and we don't correct the problem? What are we looking at as far as down the road?
Sure. There's a lot of research these days that connect your hearing, memory, and processing together. So if you're waiting for too long, it's like a muscle that's not used for a long time. There's going to be atrophy over time. And by the time you're ready, your nerve has gone down so much that no hearing aid would actually help you. Also, with untreated hearing loss, there's a lot of other social and emotional consequences. You start withdrawing from all your social activities because you're no longer able to hear and enjoy your conversation. And there's it's also a huge risk factor for depression because you're so isolated that you're now getting depressed because of it.
Yes, indeed. We can all see how that would happen.
Oh, yeah.
And I just wanted you to elaborate a little bit more on what you touched on earlier, and that is how the hearing aids now are custom fitted to really precisely meet one's lifestyle. We get to choose what we feel best fits us as opposed to a cookie cutter off the shelf approach.
Oh yeah, definitely. So with hearing aids now, with the change in digital technology, their hearing aids have up to 20 channels. By that I mean we're able to go in each individual frequency and customize it more closely so the sound is more natural. Before it used to be even with the earlier digital aids, when you turn them up, all sounds came up, and a lot of times patients came back and said, it's loud, but now everything is loud and noisy. With the advancements in digital technology, now we're able to customize it, so we're able to eliminate some of the background where the hearing is good and focus on just on the frequencies where they really need the amplification.
Yeah, and that's the major advancement right there that has taken place in hearing aids, as far as taking everything to the next level to allow us to get our hearing and our lives back in the manner that we hadn't had for years. And can you tell us a little bit about some additional advancements that have taken place as well?
So, of course, the size has gone smaller. If you look at it, you don't really know that somebody's wearing a hearing aid in their ear. But also with the changes in technology, we're able to better control for background noise, better able to control for any clarity, to boost up the clarity. Or if you're driving, you have family sitting in the background, they're facing away from you, we're able to better direct that conversation. Or if you're playing golf, there's a lot of wind noise in the background, we're able to cut some of that more efficiently. And also, you know, with more and more younger generations looking into hearing aids, now there are hearing aids that pretty much can connect with your phones, with television, so you're able to hear the TV better, talk on the phone better, and things like that.
Yes, indeed. All through the advancements that have taken place, all to the patient's benefit.
Absolutely.
What types of hearing problems do these hearing aids that you offer and that are available address, doctor?
So it also helps with, you know, wind noise, helps a lot with the TV. Now that the TV is directly connected to the hearing aid, the other person is not complaining that the TV is too loud. And with phone, before it used to be a disadvantage because you're using only one ear, and also you're missing information because you're not directly looking at the person, so you're missing all the visual cues, so you're at a disadvantage. With the hearing aids now having the ability to connect to the mobile devices, the hearing aids basically act as your headphones, and you can stream whether it's conversation or music directly to them. So now you're hearing 2 ears to hear, so you're overcoming some of that disadvantage when you're using the traditional phone.
That's wonderful, doctor. That's another great benefit right there.
Absolutely.
That's really taking it to another level.
Oh, yes.
How much hearing can be restored through a hearing aid? And I throw in the disclaimer that I'm sure that varies. I'm sure that varies based on each particular patient and how much hearing loss they've had and so on and so forth in their condition. But in general, what is somebody looking at?
Basically, there is a significant improvement, and in our practice, we do testing before and after they're fit. After they're fit, as we're following up with them, we usually do another hearing test to compare with and without the hearing aids, so we have an objective data to see how much of an improvement that they're getting. And most people notice the significant improvement in speech and noise tests, because as the noise levels go up, without the hearing aids, they're missing most of the sentences, and now with the hearing aids, they're all the way up to normal range. So that's where you see the most significant improvement.
Very interesting. And how long do the hearing aids typically last?
On an average, it lasts about 5 to 6 years, but everybody is different. I have some technically savvy people that come in every other year, say, okay, I'm ready to get upgraded. And at the same time, I have patients that go for 7, 8 years and say, hey, my hearing aids are doing what they're supposed to do. My lifestyle hasn't changed much. I'm doing fine. I'm going to wait till the hearing aid completely dies off. So it's different with everybody, but on an average, about 5 to 6 years.
Certainly good to know, doctor. We're now going to meet a couple of patients of Dr. Khatri. Welcome, Pradeep. It's a pleasure having you on our program.
It's nice to be here.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, by asking you, Pradeep, if you can tell us what brought you here to Dr. Khatri.
I was having a lot of hearing trouble. I mean, sitting down with my family, I could not, catch certain phrases or hear certain things. And it was a little, traveling with my family was a little getting difficult to hear them, So that's the reason why I got to hear about family hearing services, and that's what brought me here.
Oh, okay. So it started affecting your day-to-day life.
That's correct.
Over a period of time, you started hearing the people around you less and less, and they had to speak louder for you to probably hear
That's
what
true.
that you could hear in the past at a normal tone.
That's true.
So then you found Dr. Khatri, you
Yeah.
came to her, and can you tell us what happened? What took place?
I live in the area close by. I was looking for an audiology clinic close by, and I set up an appointment to be seen by Dr. Khatri.
So then you came here, and did you go through a consult, and what took place specifically so folks out there watching have an idea of what are they looking at as far as diagnostic goes to find out where they are with their hearing loss?
Yeah, I was immediately consulted by Dr. Khatri at my appointment, and I was asked all the basic questions that needs to be asked as to what is my trouble. She had the patience to hear me out, and then we had a hearing test to be was conducted, and as soon as that was done, the results were shared with me.
So then the results were shared with you, and what did they show, Pardeep?
There was a significant hearing loss on my right ear.
Oh, sorry to hear that. And that was technology-based diagnostic testing. Is that
Absolutely,
what determined?
the latest technology, and I did notice that there was a up to date. Everything was all up and clearly visible to what was happening within the hearing test.
Oh, so then when you found out through Dr. Khatri after going through the testing that you had suffered significant hearing loss with your right ear, what took place then?
Once the results were shared, we had another sit-down session with Dr. Khatri at the same appointment time. She had told me that I had a hearing loss, and brought me solutions to saying that these are kinds of the technologies that that are available, and she cross-verified my insurance information with me to make sure that I do qualify to get as much possibly paid by the insurance, and then clearly clarify the numbers of the hearing aids cost.
Oh, so did you qualify for the hearing aids being covered by the insurance in this
Part of
case?
it was, yes.
Oh, that's good to know.
Yes.
That's good that that's available for everyone out
Absolutely.
there who has health and dental insurance.
Yep. During the consultation of the hearing aids, Dr. Khatri showed me all kinds of hearing aids that are available in the market today, and that'll best fit the need for my lifestyle.
Oh, and that's good to know. It's no longer the days of the bulky hearing aids where you only have a couple of options, because a lot of people, unfortunately, and they don't realize that over the years, through the advancements in technology, we now have such a wonderful selection to choose from, small to literally invisible hearing aids that really fit our lifestyle, as opposed to what at one time we had no choice but to wear the bulky hearing aid.
That's true. I mean, I was also amazed with the kind of solutions that Dr. Khatri had provided to me, and the technologies that are out there. To top it all off, I was not in a decision to buy the hearing aids right then and there. Okay. Dr. Khatri offered a 2-week trial period to see how it fits my lifestyle for the next 2 weeks. So I had a good, just like a trial run with the hearing aids to see whether it is a real step up to improve my lifestyle.
I think that's a significant benefit right there, Pradeep, because I've interviewed audiologists over the years, but I can honestly tell you, Dr. Khatri and her practice here is the first of its kind that actually gives you a trial run of a couple of weeks to see how that customized hearing aid feels, how it improves your hearing, and then at the end of the 2 weeks before you commit to purchasing it, of which a good chunk of it is covered through most insurances, you can then determine which one you want, whether you want to switch up to another one to try, or if you like that one, then you go with that one.
Absolutely, and that 2-week trial period actually gave me the things that I'm missing out on, and gave me the need to see that there is a solution out there.
Now, how do you feel about the results?
It's great. I mean, the 2-week trial kicked off everything for me. I mean, I was literally enjoying listening to what I was missing. And now it is just better time with the family, and I'm not missing out on anything.
And your hearing, I take it, off the one that you got has brought you back to what it was? You don't have to keep asking your relatives and friends to speak louder or saying, I'm sorry, what did you say? No more of that?
That's exactly right.
Now, before I let you go, Pradeep, any final thoughts you'd like to share with our viewers?
I would highly recommend Dr. Khatri to anyone who's suffering from hearing loss or hearing problems to help improve the quality of their life.
Well, on that note, we'd like to thank you, Pradeep, for joining us, being a guest, and sharing some of your experiences with us.
Thank you.
Welcome, Scott. It's great having you on as well today.
Thank you very much for having me.
Our pleasure. And I wanted to begin, Scott, by asking you if you can please tell us what type of hearing problems were you having that brought you to Dr. Khatri?
Well, my hearing problem is what I understand a very common one. I was having trouble with clients and at home and saying that, could you say that again? And and it just got old trying to cover for like it wasn't my hearing. It's like they said something. So it was a very common thing, and here I am.
Yeah. So then you came here, and what happened?
I had the consultation, and I discovered that education is the most important part of this because I didn't know. So by doing some tests and going into the booth and doing all those great things, we discovered what I needed, and we took care of it.
That's wonderful. And what was the solution in your particular case that you had done?
The solution in my particular case was being fitted with the proper hearing devices, and my only request was that I look cool in them. So and we went through a couple different ones, and I found the ones that I wanted, and now things are a whole lot better.
I take it you don't have to be asking people, what did you say anymore?
No, I do not.
And lastly, before we let you go, any final thoughts about your experience and what that's been like with the staff here as well?
The doctor and the staff here are amazing. They make you feel comfortable, because it's slightly embarrassing not to be able to hear certain things, and they just treat you so well. And I left here just a new person.
Well, on that note, we'd like to thank you as well, Scott, for joining us, sharing some of your experiences, and being a guest on our program.
Thank you very much.
It's our pleasure. We're now back with Dr. Khatri.
Sure.
Patients seem very pleased with the results.
That's great. Yes, that's what we are here for, is to make a difference and help other people hear better.
Now, we're literally out of time, Dr. Khatri, and I wanted to ask you, before I let you go, you and your practice, Family Hearing Services here in the Chantilly, Virginia region, have certainly established a reputation for excellence, not only in patient care, but service. You have a state-of-the-art office offering the latest and greatest in hearing solutions to fit so many different lifestyles. What would you say helps separate you and your practice apart from many of the others?
There's a few different things. We're more a medical-based model. We work very closely with all the physicians in the area. We want to make sure that we're all on the same page when it comes to the patient's care. And we also a comprehensive care clinic. We do everything from diagnosis, treatment, and also focus greatly on prevention. We're involved with the community. We were at the Chantilly Day event promoting on hearing loss prevention and kind of educating people in the area about it.
You were actually one of the guests over there educating the public.
Yes. And also we take more of an educational approach in letting the patient, kind of giving them all that is involved. I believe the more the patient is educated about it, the better they're able to decide what to do and what's the right next step. And my role is more to lead them to better hearing rather than pointing out and saying, okay, this is what is going to work. If you don't do this, they're not going to be able to hear your family. That's not my approach. And we also offer our 2-week risk-free trial. In that way, the patient is able to come in, try out new technology hearing aids. There's no commitment to purchase them. There's no obligation. You come in, test try them, take them out in your everyday listening situation so you're more comfortable with the whole idea of using hearing aids. before you move forward into actually purchasing them. And we deal with multiple manufacturers rather than narrowing it down to one manufacturer. I work with multiple ones because everybody's experience with hearing is different, everybody's needs are different. So we focus on the patient's needs. That's the most important part.
You are certainly a patient-centric practice
Absolutely.
that views each patient as a partnership as far as customizing a solution that best fits his or her needs. The patients we had on earlier, our research has shown that as well. You're doing a tremendous job in helping so many people regain their lives, the quality of their lives, because we know too many people, unfortunately, that suffer from hearing loss, and others who may not know it, but you do as well in some cases. So you need to come to a doctor like yourself and take the next step to get our lives back.
Definitely, definitely.
And on that note, I'd like to thank you, Dr. Khatri, for joining us and being a guest on our program. We'd love to have you back on in the future.
Thank you so much for having me.